Welcome back to another episode of Radha Patel NP Reviews. So today we're going to talk about skin system. We're going to cover mainly three very important topics for upcoming AANP and ANCC exam. So let's get started. We're going to cover basal cell carcinoma, melanoma, and actinic keratosis. So here we're going to talk about anatomy first. Okay. So we have epidermis, we have dermis, and we have hypodermis. Epidermis mainly has, all those cells where we have basal cell, squamous cell, stuff like that. In dermis, we have sweat glands, we have macrophages, we have mast cell, dendritic cell, we have, arteries and veins and stuff like that, blood vessels. We also have the hair follicles, okay? And in hypodermis, we have fibroblast, adipose tissue, stuff like that. Now, let's talk about some skin lesions. We have macules, papules, plaque, vesicles, bulla, pustules, wheal, and nodule. How do you know the difference? Which one is which? Okay, so macules, remember, is flat. Okay, papules is little bit raised. Plaque is large. Vesicles are fluid-filled. Bulla is also fluid-filled but bigger than vesicles. Pustules has pus in it. Wheals are think like hives. Nodules are deeper and solid. Okay? Now, next one is basal cell carcinoma. This topic is very important for the exam. Basal cell carcinoma is the most common, skin cancer. Okay. Now, how do you recognize it? It's waxy, pearly, dome-shaped nodule on top of the nose or ear or forehead with or without telangiectasia. Telangiectasia is small blood vessels goes on top of the nodule. Okay. What do you do? Excisional biopsy. That's the treatment. Get rid of the lesion, and you can also refer them to dermatologist. Okay. Actinic keratosis, which is rough, dry, scaly. It's been there forever. Doesn't heal. That kind of lesion. Okay. So, what do you do if that type of person comes in primary care? The gold standard test is to do punch biopsy, and then you can refer patient. Remember, very important topic. Actinic keratosis is the precancerous lesion of squamous cell carcinoma. Okay? They love that question in the exam. Okay. Treatment is 5-FU cream, which is fluorouracil cream. You ask yourself, like, how does that medicine work? Okay. So this medication works. It's kind of like topical chemotherapy. So you apply it and try to shrink down those lesions. So that's how it works. Now next one is melanoma. Melanoma, here we need to know ABCDE of melanoma. A is asymmetry. That means half of the lesion is different color. Okay. Border is irregular. Color is multiple different color. You can see like reddish color, brownish color, blackish color. Diameter is greater than 6 mm, which is greater than pencil eraser. Evolution, that means it's changing. Okay. And it's also E means elevated from the skin. Okay. So that's how you diagnose melanoma. What do you do with melanoma if you see those, You're going to have to refer that person to dermatologist. There's another type of melanoma which happens to less than 5% people population. So they have, how do we know that it's acral Lentiginous melanoma? So acral Lentiginous melanoma normally happens on their heel or on their nails, stuff like that. So it's a subtype of melanoma. It appears as dark brown to black color lesion. It's seen on palms and toes and nail beds and stuff like that. So how do you remember this? Pigmented lesion on the palm, sole, or nail. That is acral Lentiginous melanoma. And that's it. See you in the next one.